are sinus lifts used for incisors. Understanding the procedure's application. Sinus lifts, or sinus augmentations, are dental surgical procedures aimed at increasing bone volume in the upper jaw, especially beneath the sinuses. They are commonly associated with preparing the jaw for dental implants. But when it comes to the placement of implants in the incisor region, is a sinus lift necessary? This article delves into the specifics of sinus lifts and their relevance to incisor implants. Anatomy of the upper jaw. The upper jaw, or maxilla, houses both the molars at the back and the incisors at the front. The sinuses are closer to the molar and premolar areas, which means these regions are more commonly affected by bone loss that impacts the sinuses. Why sinus lifts are typically performed. Bone loss. After tooth loss, especially in the molar and premolar areas, the bone starts to resorb or shrink. This can bring the sinus floor closer to the jaw surface. Dental implants. For successful implant placement, a certain bone height is required. If there's insufficient bone due to proximity to the sinuses, a sinus lift is performed to create more space. Incisors and sinus lifts. Location. Incisors are located at the front of the mouth, far from the maxillary sinuses. Therefore, the need for a sinus lift for incisor implants is rare. Bone quality. While the bone quality in the incisor region might be thinner, it's usually the bone's depth, height, related to the sinuses that necessitates a sinus lift, not the bone's width. When might incisors need bone augmentation? While sinus lifts might not be common for incisors, other bone augmentation procedures might be needed. Bone grafting. If there's been significant bone loss in the incisor region, bone grafting might be required to ensure stability for the implant. Ridge expansion. If the jawbone isn't wide enough to support dental implants, a ridge expansion might be performed. Conclusion. Sinus lifts are primarily associated with preparing the upper jaw for molar and premolar implants due to the proximity of these teeth to the maxillary sinuses. While it's uncommon to perform a sinus lift for incisor implants, it's essential to assess the bone quality and quantity in the incisor region. A dental professional will determine the best approach to ensure successful implant placement, whether it's a sinus lift, bone grafting, or another procedure.